You might know this molecule as a dye, but what if I told you it's also a mitochondrial miracle? I'm talking about methylene blue. It was first synthesized in 1876 as a textile dye, but early on, doctors discovered its antimicrobial and anti-malarial powers. Fast forward to the 20th century, it became the first drug used in psychiatry, and today it's making a comeback for brain health and mitochondrial function. Methylene blue is a synthetic compound with a unique ability. It accepts and donates electrons. That means it can shuttle energy inside your cells, especially in the mitochondria, your body's power plant. Inside your mitochondria, methylene blue bypasses blockade parts of the electron transport chain. It literally helps your cells make ATP more efficiently, especially when you are under oxidative stress. Studies show low doses of methylene blue can improve memory, attention, and mental clarity. It increases cerebral oxygen consumption and blood flow, giving your brain a metabolic advantage. Methylene blue reduces reactive oxygen species and stabilizes mitochondrial membranes. In animal models, it slows age-related cognitive decline and protects against neurodegenerative diseases like Alzheimer's and Parkinson's. It also is a reversible MAO inhibitor, meaning it boosts serotonin and dopamine without the harsh side effects of conventional antidepressants. This makes it a fascinating adjunct in mood disorders and even treatment-resistant depression. Feeling sluggish? Because of its mitochondrial effect, methylene blue can actually improve cellular energy, reduce fatigue, and enhance physical performance. It's like cellular octane booster for your body. Beyond energy and cognition, methylene blue has broad-spectrum antimicrobial properties against bacteria, viruses, and fungi. It's even been used in blood sterilization and treating urinary tract infection. From improving memory and mitochondrial function in rats to human trials in Alzheimer's, depressions, and fatigue, research on methylene blue is expanding. The data supports its promise, especially at low doses. So potential applications, cognitive enhancement and brain fog relief. Methylene blue is a rising star in cognitive enhancement. It improves mitochondrial efficiency and boosts cerebral oxygen consumption, leading to better attention, mental stamina, and clarity. Biohackers often stack it with red light therapy to amplify neurocognitive effect. In fact, it's been studied in Alzheimer's disease for its ability to slow down beta amyloid aggregation and reduce neuroinflammation. In its effect in chronic fatigue and mitochondrial dysfunction, if you're feeling drained, methylene blue helps cells make ATP more efficiently. This is crucial for people with mitochondrial dysfunction, whether from aging, stress, or chronic illness. Many patients with fibromyalgia or general fatigue improve stamina and reduce crash cycle with microdosing. Long COVID sufferers often report persistent fatigue, brain fog, and mitochondrial dysfunction. Methylene blue offers dual support. It boosts energy production and acts as a mild antiviral. Its antimicrobial properties extend to resistant bacteria, parasites, and viruses, making it a supportive agent for chronic steel infection like Lyme and Epstein-Barr. Some rare mitochondrial diseases like Lee syndrome or MELAS, MELAS, involve defect in energy production. While not a cure, methylene blue has shown potential as a supportive therapy, restoring partial energy flow in damaged mitochondria. Methylene blue is a reversible MAO inhibitor. That means it can elevate serotonin, dopamine, and norepinephrine, helping some individuals feel lighter and more emotionally balanced. In clinical studies, it reduces depressive symptoms, especially in treatment-resistant cases or bipolar depression when used adjunctively. Methylene blue is a broad-spectrum antimicrobial. It disrupts the DNA and enzymes of microbes and has been used to treat infections of the blood, urinary tract, and lung. It's even used in blood bank to sterilize plasma. When combined with light therapy, methylene blue can destroy pathogen without antibiotics. At the cellular level, aging is largely mitochondrial decline and oxidative stress. Methylene blue combats both, preserving energy flow, reducing free radicals, and supporting autophagy. It's been explored in longevity circles as a mitochondrial senolytic, potentially helping clear out dysfunctional cells and extending health span. Despite these exciting applications, methylene blue is potent. High doses can be toxic. It can interact dangerously with antidepressant. Quality matters. Never use aquarium-grade products. Start low, go slow, and always consult a qualified professional. Methylene blue comes in several forms, so most popular for biohackers in the pharmaceutical grade liquid or capsule, taken orally in microdoses. In medical settings, it often delivered intravenously for serious infection or methemoglobinemia. But IV use should only happen under medical supervision. Never use aquarium-grade methylene blue. It's contaminated and unsafe for human use. Most of the cognitive, mitochondrial, and neuroprotective effect of methylene blue appear in the low dose range, between 0.5 to 4 milligram per kilogram of body weight. So let's break that down. For somebody who's a 70 kilogram adult, that's around 35 milligram to 280 milligram, with the most people staying closer to the microdose range of between 5 to 30 milligram per day. Higher doses, especially about 5 milligram per kilogram, can increase the risk of toxicity and side effects. Here's a critical warning. Methylene blue is a reversible MAOA inhibitor. That means it can dangerously increase serotonin if taken with antidepressants like SSRI, SNRIs, MAOIs, or even certain herbal supplements like St. John's wort. This combination can trigger serotonin syndrome, a life-threatening condition marked by agitation, high blood pressure, tremors, and even seizures. If you are on any serotonergic medication, do not take methylene blue. So SSRIs include, they're not limited to, fluoxetine, sertraline, citalopram. SNRIs are venlafaxine, duloxetine, and MOA inhibitors, also tramadol, dextromethorphan, linezolid, and St. John's wort. Side effects of methylene blue are dose dependent. At low doses, it's usually well tolerated, but you may notice some blue or green urine, which is normal and harmless, mild nausea, headache, or dizziness, especially if you go high too fast. At high doses, there's increased risk for methemoglobinemia, reversal, chest pain, elevated blood pressure, and even hemolytic anemia in vulnerable individuals. Rare but serious risk is hemolysis in patients with G6PD deficiency, hypersensitive episodes, confusion, or serotonin syndrome in medication overlap. Not everyone should take Methylene Blue. Avoid it if you have G6PD deficiency, if you're pregnant or breastfeeding, if you're on serotonin boosting medications. And of course, G6PD deficiency screening is recommended before use. So want to try it? Well, start with microdose around 0.5 milligram per kilogram or even lower. Stay there for 3 to 5 days and watch how your body responds. If well tolerated, you can titrate it up slowly. Most people find their sweet spots in the range of 5 to 20 milligram per day for cognitive and mitochondrial support. More is not always better, especially with this molecule. Methylene Blue can be safely stacked with other mitochondrial enhancers like red light therapy, CoQ10, and NAD+ precursors. This synergy can amplify brain energy and cellular repair. By stacking with serotonergic agents, high-dose caffeine or recreational drugs can raise risk. Respect the compound. It's powerful, but precise. The most common form used in biohacking and cognitive support is the pharmaceutical grade liquid. It's taken orally, either directly on the tongue or diluted in water. Most users dose between 1 to 20 milligram per day, depends on their goal. We are standing on the edge of something remarkable. Methylene Blue, this century-old molecule, might just be the next frontier in neurodegenerative and anti-aging medicine. Right now, clinical trials are actively investing Methylene Blue for a range of cutting-edge applications, such as traumatic brain injury and stroke recovery, neurodegenerative diseases. Methylene Blue as part of a daily neuroprotective stack to delay or prevent neurodegeneration. In anti-aging and cellular longevity, this is where it gets exciting. Methylene Blue isn't just a brain booster, it may be a true mitochondrial longevity molecule. By enhancing mitochondrial respiration, reducing free radical, and preserving cellular redox balance, Methylene Blue may slow aging from inside out. We're talking about a potential blue pill that targets aging as its energetic course. Emerging research is exploring how it may activate NAD+ cycling, support telomere stability, and reduce DNA oxidative damage. Imagine a future where your Methylene Blue dose is tailored daily based on your wearable genetics or blood markers. Artificial intelligence and biofeedback loops could determine the exact moment your brain or mitochondria needs support. AI and pharmacogenetics equals personalized Methylene Blue protocol for brain performance and lifespan. As we enter the era of nootropic stacks, researchers are beginning to examine Methylene Blue alongside other cognitive enhancers. This isn't just a nootropic, it's a molecule with the potential to redefine aging, brain injury treatment, and metabolic resilience. The more we study it, the clearer it becomes. We are just scratching the surface. In 5 to 10 years, Methylene Blue might not just be an experimental biohack. It could be a core tool in personalized medicine, helping us live longer, think clearer, and recover faster. Methylene Blue is not just a dye, it's a brain booster, energy enhancing, longevity promoting compound. When used correctly, it's not a magic pill, but it's a potent tool in the biohacker's arsenal. If you are ready to optimize your mind and mitochondria, or want an expert guidance on how Methylene Blue fits into your personalized health plan? Connect with us today.
Please don't forget to like, comment, share, and subscribe.